With a global incidence of 400 per 100,000 people between 1990 and 2016, brain infections are relatively rare compared to other health hazards. But despite its low occurrence and remarkable progress in the health sector, it continues to be a leading cause of death, particularly in developing countries. From breathing to complex decisions, the command center to your entire body, i.e. the brain, has it all figured out. But how do we know if something is meddling with its smooth functioning? It's simple. All you need to do is watch out for the following warning signs and start on your mission: Operation Brain Health. Number 1. Have you started losing hold of your basic cognitive abilities? Consider this. Your telephone rings. You hear it. This is your perception. You choose to answer it. This counts as decision-making. You lift the receiver. Your motor skills. You have a conversation. Language skills. You interpret the tone of the other person and interact with suitable emotion. These are your social skills. All of these fall under the banner of cognitive function. Now think, what if these basic brain-based capabilities are affected? Well, you would no longer be able to function properly. And in several cases, you may even end up with dementia, a disorder leading to a serious decline in an individual's cognitive abilities involving memory, abstract thinking, social and visuospatial skills. Now the question is, what causes dementia? Well, there isn't one particular cause for it. Instead, it can have multiple reasons for its occurrence. And Alzheimer's disease is one of the most common causes behind it, with a significant contribution to almost 80%. This happens because Alzheimer's comes with a buildup of two dangerous structures in the brain, which messes up its regular functioning. The first one is amyloid plaque. These are clumps of beta amyloid, an essential protein in the brain. But the moment these proteins decide to clump together and form significant groupings called plaque, they disrupt the communications between the nerve cells, and you can no longer pass on vital information easily. And these buildups are usually prominent in the memory region of your brain, the hippocampus. Your power to retain things is hampered. The other one is neurofibrillary tangles. This time, it's another protein called tau, which is responsible for keeping the microtubules in the brain stable. These microtubules move nutrients and information between cells. When tau is affected, possibly due to genetic mutation, the fibers get twisted up, causing the degeneration of neurons. Nutritional deficiencies where your body runs out of essentials, such as vitamins B1 and B6, can also cause dementia. Meningitis, brain abscess, and encephalitis are some central nervous system infections that can also be blamed for messing up your cognitive skills. Number 2. Headaches that refuse to go away. Many of your routine activities are put on hold when a throbbing headache arrives. Not only are they annoyingly painful, but they can sometimes be good indicators of underlying brain disease. 98% of the headaches are primary and can be caused by simple lifestyle factors, including a disturbed sleep cycle, too much alcohol consumption, stress, incorrect eyeglasses, being overworked, poor posture, and inadequate diet. On the contrary, secondary headaches are relatively uncommon, and their timely recognition is crucial as they can be life-saving. Fatal brain infections like meningitis and encephalitis can be some of the reasons behind these excruciating headaches. 3 layers of membranes called meninges surround your brain and spinal cord. The outermost layer is called the dura mater. The middle one is the arachnoid, which is composed of a web-like structure filled with fluid that serves as a cushion to protect the brain, and the innermost layer, which is the most delicate, is the pia mater. When these layers come under a microbial attack from bacteria, viruses, fungi, and parasites, they swell up, and we experience a condition called meningitis. When this attack spreads to the entire brain, inflammation is likely to develop into another severe medical condition called encephalitis. This can either be by direct infection or by an immune response to an infection. Well, your body has its own defense mechanism to fight infection, often called the immune system. So when an unwanted enemy enters, your body retaliates by disbanding its army of immune cells, which then fights the infection-causing agents and forces them to retreat. And, just like battleground scars, this sometimes leads to minor inflammation. So yes, a severe headache can be a hallmark sign of a major brain problem. Number 3, you've started having seizures lately. Anything that causes structural or functional alterations to the brain's physiology may lead to a seizure. Around 5% of people affected by infections of the central nervous system experience seizures. These infections include herpes simplex, HIV, bacterial meningitis, and brain abscesses. Seizures occur due to the direct invasion of brain tissue by the infecting organism, the production of toxins by the invader, or an immune system response that results in inflammation. Any of these three causes can trigger the breakdown of the blood-brain barrier, or may even cause cerebral edema or swelling of the brain. What if you're experiencing recurring seizures? Well, it could be because of epilepsy. It is the most common serious neurological condition affecting 70 million people around the globe and can lead to permanent brain damage if left untreated. In the long term, seizures worsen and often result in coma and death. Unprovoked and reoccurring seizures not only affect your health but also degrade the quality of your life. You cannot drive freely anymore or partake in activities like swimming and traveling because you'd need assistance for most regular activities. There's another reason why seizures occur: brain abscess. Fungi, viruses, or bacteria reach your brain through a wound in your head or infection somewhere else in your body. This causes your brain to swell up from the collection of pus and dead cells. A head injury, compromised immune system due to HIV or AIDS, immunosuppressant drugs used in chemotherapy, and chronic sinus and middle ear infections can be some of the reasons behind brain abscesses. Number 4, you feel tired and feverish. Are your mornings low and dull? Does constant fatigue and weakness cripple your daily routine? Random chills and reoccurring fever keeps hitting you out of nowhere? If yes, it's time to act and take the matter seriously. It could be a brain infection. And do not think that by fatigue we only mean weakness in the body, because we're talking about mental fatigue too. Well, mental weariness can be a nightmare. You tend to give up on any sort of work that involves applying your mind. You feel constant pressure on your nerves. Minimal thinking seems too much for you. And while you're fighting this isolated battle in your brain, you appear moody and irritated to the world outside. And what about those random chills that you keep experiencing every now and then? And the fever that makes surprise visits and swift retreats? Well, brain infections like encephalitis and meningitis typically begin with fevers and are often accompanied by headaches and many other symptoms. Also, fever is a common medical sign of brain abscess, occurring in approximately 55% of patients. But did you know it requires 8 days after the onset of symptoms to identify a brain abscess? That's true. And due to the vagueness of these signs, establishing cerebral inflammation can be time-consuming. After all, fever and fatigue, being non-specific symptoms, can often mimic other diseases, making brain infections harder to diagnose. Number 5, you have trouble with communication. It's okay if you can't speak in a crowded room or have problems understanding speech sometimes, but what if this troubled communication persists? And what is the underlying cause? Well, it could be brain disease. There is a specific medical term for this language impairment: aphasia. It is caused by damage in the cortical center of the brain. Neurological disorders, brain injury, and cerebrovascular accidents, which are the result of blood clots and broken blood vessels in the brain, could be the reason behind them. And yes, it could be cancer too. If the tumor is in part of the brain that is responsible for language, then it is most likely that your speech will become affected. This impairment can be mild to severe depending on the extent of the damage. Studies have shown that a neurological condition called multiple sclerosis can also be one of the reasons behind impaired speech in the affected individual. Multiple sclerosis occurs when immune cells attack myelin, which is the sheath around the nerve cells. This causes major disruptions in the communication between your brain and the rest of your body. Other possible explanations for its occurrence can be vitamin D deficiency and genetic inheritance. Now the question is, how do we keep these brain infections at bay? Well, neurological disorders can be fatal, and most of their specific causes might not be diagnosed without further testing. However, doctors advise that keeping your surroundings neat and tidy, washing your hands regularly, maintaining basic hygiene, eating a nutrient-rich diet, and doing regular exercise can help you to a great extent in dealing with them. And don't forget, if anytime you feel that you have a brain infection, do not ignore the symptoms. Act right away and consult a doctor. Want to learn more about your brain? Watch 12 best anti-aging herbs that help protect the brain and memory loss, or 7 early warning signs of a brain tumor you need to know about. Go ahead, click one, or better yet, watch both. What warning signs did you notice lately? Let us know in the comments below.